This is Dr. David Allen coming to you on the television program, People Helping People. Tonight I have a special treat. One of our most recently qualified psychiatrists, Dr. Tameka Johnson-Dames, has just completed her research on cannabis, marijuana. Tonight we're going to talk about marijuana. What should we do? Should we legalize it? Should medical marijuana be used? What should we do? Dr. Tameka, congratulations on your becoming a psychiatrist.
Thank you.
So wonderful to have a wonderful psychiatrist like you in our midst. And you took on the heavy task of doing a research paper on cannabis, marijuana. What did you find?
So let me start first of all by saying thank you for having me here on the show. It's definitely a pleasure. When I started to think about research topics, I realized that we were in an era where a lot of persons were interested in recreational cannabis, medical marijuana, and all of these topics were buzzing around. And I wanted to see what the findings would be as it relates to cannabis use and the disorders that we would typically see at the Sandilands Rehabilitation Center where I work. I realized that we definitely did see a lot of psychotic illnesses, but I hadn't seen any recent studies done on the population there and the admissions there. So I did a study looking
One second,
at...
doctor. You said you see a lot of psychotic illnesses.
I do.
What's a psychotic illness?
So when we look at psychotic illnesses, it is any illness where there is a change in your ability to respond with the outside world. Persons that are now experiencing a variety of symptoms. It can be hallucinations where you may be hearing voices or seeing things. It can be delusions where you feel paranoid or where you believe that you have some special power or talent. And then a general change in your behavior. Either your behavior is disorganized or your speech and your thoughts are disorganized. So all of those kind of paint a picture of what a psychotic illness looks like. So we have a variety of psychotic illnesses that we manage at Sandilands. And one of those is cannabis-induced psychosis. So we tend to see a lot of persons...
So marijuana can make you psychotic?
Yes, it can cause persons to develop...
But everybody smokes all the time. They don't go psychotic, do they?
And that's the catch. So there are a number of persons that use cannabis, and while I agree that there are a number of them that function quite well, that never end up with psychotic symptoms, that never end up being brought to the emergency room, that never end up admitted to Sandilands, but there is still a significant proportion of persons that do end up developing these psychotic symptoms. And those are the persons that I would have studied in my most recent research.
And doctor, can you tell, for example, if one's going to take a joint, how do I know whether I'm going to be psychotic or not?
So there's no way that you can tell that definitely will happen.
Well, isn't that scary?
But right, it's very scary. But there are things that you can look at in your family history and your background that may clue you into the fact that something may potentially happen. So take, for instance, young male with a family history of psychotic illnesses. Doesn't have to be a drug-induced illness. It can be schizophrenia, schizoaffective disorder, or any number of mental illnesses. Once you have that family history, you're already genetically predisposed to developing a mental illness. So using a substance that alters the brain, like cannabis does, you're definitely at risk for developing psychotic illnesses.
So doctor, you're saying before you smoke a joint of marijuana, you should check out your family history?
It would probably be a good idea.
Should we do that in our country?
I think we should, because a lot of persons are lucky in that they develop these symptoms after using marijuana. We treat them for the illness, they're discharged, they return to baseline, they're able to function quite well. But there is still a proportion of persons, especially our young men, that smoke marijuana, that end up in hospital, and that remain unwell for the most part. That we've given them medication, that we've had them in hospital for a significant period of time, that we've tried various things to stabilize them and the symptoms that they presented with, and that they don't recover.
Oh, that's scary. You're saying a young Bahamian male can take a joint of marijuana or two, develop a psychotic illness. You take him into our treatment unit at Sandilands. By the way, we have an excellent treatment unit at Sandilands. We have some young doctors up there, these young psychiatrists. They are fantastic. One of the best treatment units in this part of the world. It's really important, family, fellow Bahamians, be thankful for Sandals. It's doing a wonderful job.
Thank you.
But you said that young men may take a joint, they get a psychotic illness, you treat them at Sandalins, and even though they've had the treatment, it doesn't resolve the psychosis?
Some of them.
So what do you do then?
So in that case, we try our best to get them to a comfortable baseline where they can manage, where their families can manage.
But they're never the same again.
No.
Oh, doctor, that's
And
scary.
it's disheartening.
I mean, just a simple joint can make a person become psychotic, get treatment, and never come back to who they were?
It can. So
you really go on a trip and don't come back.
So here's the thing, Dr. Allen. There are some persons, so there have been lots of studies done on cannabis, right? And so there's always this debate about, is it that the cannabis causes it, or is it that it's just an association? So the study that I did was a study that looked at the associations. Well, is the use of cannabis associated with the development of these symptoms? So I definitely found that there was an association, but there's still a lot of debates about whether or not this is the actual cause. Would this person have...
In other words, your study said or found there's an association between psychosis and marijuana use.
Correct.
But you couldn't say that's causation.
Correct.
Right. So we have to be very careful in research, particularly in medicine.
Yes.
That we do not equate causation
Correct.
with association.
Correct.
So your study looked at what?
Associations.
Association. And what did you find?
So I definitely found that there was a significant proportion of our admissions that were coming in during that 2-year period that I studied. That would have been between 2019 and 2021, where a significant proportion of our cases of psychotic illnesses were persons that were also using cannabis. Now, I tried to measure different variables. One of the variables was whether or not family history had anything to do with the development of these symptoms. So that was not as statistically
family
significant.
History of what?
Mental illness.
What kind?
Any mental illness.
Depression?
Depression, anxiety, psychotic illnesses,
alcoholism,
mood disorders, other substance use disorders, correct. I didn't find that that was significant, which may have been because of the smaller sample size. So maybe an adequately powered study, a study with way more persons, maybe done over a longer period of time, may have yielded those results. But definitely those are results that are found in studies elsewhere. So I looked at family history. I also looked at whether or not these were persons that used other substances. So you're persons that use cannabis, but they also drink alcohol. They also use cocaine. They also use nicotine. So there are other substances that further add to the problem of developing mental health issues, so not just the cannabis. Mm-hmm. One of the more significant findings that I did have was that about 70% of the patients that had a diagnosis that changed over time. That means from your first admission to Sandilands, when we tracked the admissions over the years that you'd been coming or the months that you've been coming, we looked and we realized that about 70% of those patients, their diagnosis was no longer a cannabis-induced psychosis, which could be seen as something that's not long-lasting or chronic. It converted to schizophrenia.
Wait, now let's get that. That's really important.
Mm-hmm.
A person takes a joint or two, they develop a psychosis, go out of reality,
yes,
act bizarrely. They go into Sandilands, your unit, you treat them well. Mm-hmm. Then after you do the study again, they no longer have marijuana psychosis, they have now schizophrenia?
Schizophrenia, and that's after
So you're saying marijuana smoking gives rise to schizophrenia?
Yes, and it has been studied. So my study would definitely not have been the first to look at that. It's been studied elsewhere in the US, in the Caribbean, and other parts of the world, that there's been an increased risk of the development of schizophrenia in persons that use cannabis, especially in those with a family history of schizophrenia already.
But in your study, doctor, mm-hmm. the ones who converted to schizophrenia, was their family history of schizophrenia before they smoked marijuana?
Not that it was significant.
It wasn't there?
It wasn't significant.
But isn't that scary?
It's very scary. It's very scary. And like I said, that would have been one of the more notable things that I found in the study, that this is definitely 70% of the persons that had an evolution. They used cannabis, and it started off as cannabis-induced psychosis. When we tracked them over time, we now have someone that's diagnosed with schizophrenia. And schizophrenia is a chronic psychotic illness. So what we mean by a chronic psychotic illness is that this is an illness that you will definitely have this illness lifelong. You will need treatment, whether it be oral medications, whether it be injections. This isn't to say that
schizophrenia is a long journey.
it's a long journey for you and your family.
It's an expensive journey too.
Yes.
You lose time at work.
Yes.
You lose time in your marriage. You perhaps can't have children.
Yep.
You sometimes drop out of society.
Yep.
So you're saying marijuana, if you have that tendency, you can develop schizophrenia and get knocked out for life?
Social drift.
What, pardon me?
Social drift.
What's social drift?
So you start off at a certain level, and we see it a lot. Young men, they go off to college, they start to experiment with drugs, cannabis being one of them. And so you're at the height of your life now, you're doing well in college. Some may even make it to the point where they graduate from college. And now, because you develop this mental illness, you're unable to either accept that you've developed the illness, you're unable to accept what has happened to you, the fact that you've been probably humiliated in public because of the symptoms of the illness, and now you're finding it hard to maintain a job, you're finding it hard to stay on medications, to follow up at clinic, you have frequent relapses, and then over time, it just becomes a downward spiral. Your family, you burnt bridges with them because they are now tired of the symptoms of the illness, because it can be very debilitating.
Well, Doctor, this is earth-shattering.
Yeah.
I mean, this is so important. Can you speak to the country directly, because your research, it doesn't lie.
Right.
Tell them how you felt as a mother, because I know you're a mother.
Yes.
When you came across that finding,
Right.
that 70% of people who had psychosis from cannabis became schizophrenic.
Yes.
Please tell the Bahamas that.
So definitely, I get both sides of the argument. There's an argument that, you know, there are people that use alcohol. We use alcohol, that's legal. We're free to use it in churches where they use it as a part of their communion. And then we have persons that use cannabis, like persons in the Rastafarian community, and they want to use that as a part of their religious sacrament. So we take all of these things into consideration. The point that I want to drive home with my research is know your history, know your family history, know what you are willing to risk. So if it is that you decide that cannabis is something that I'm going to try, be aware of the fact that this can happen. So when you are not faced with a loved one, or when you yourself has not developed a mental illness, you're not aware of how much it negatively affects your life, how much it is a burden to your family to have to go through this cycle of being admitted to hospital, being out of hospital, not being able to work. There are some people that function, but you do not know what will happen to you. So take those things into consideration when you make the choice to use, and that's with any drug, not just cannabis. So definitely, you know, it is very, very sad to see. It's very sad to watch, especially our young men. So there are women that use, there are women that are admitted to hospital, but the larger proportion of the study was our young males. And it is sad to see the way that we are losing our young males to cannabis. So just be careful, be mindful, know the facts, be well informed before you make these decisions.
And doctor, us poor men,
Yeah.
I mean, why us again? We get the crime, we get the violence, we get killed. Why is now Canada's want to knock us out? Why men?
Yeah, I know. I mean,
What did we do wrong being born male?
It's not that you do anything wrong, but you know, in a lot of cases, it's not that it's just males that use the drug, but it's just when it comes to the admissions to hospital, the males make up the wider majority of cases that we see.
So you don't see as many females with cannabis psychosis?
Not as much.
And
not as
why
much
would
as
that
the
be,
males.
doctor?
It's very hard to say why. It's very hard to say why. We definitely have a lot of female admissions. We typically see a lot of female admissions for mood disorders, bipolar disorder, depression. In a lot of cases, some of them do use cannabis, but when it comes to that diagnosis of cannabis-induced psychosis, a very, very large proportion of our male population.
Oh. We're going to take a break and be right back.